Do you use orthotics or insoles to help relieve foot-related problems and pain? Sure, these products may provide some temporary relief, but research has shown that over the long term, they're actually not good for you at all. Now, there's a new, more effective way to achieve optimum foot-related health that also provides enhanced comfort and performance. Hi. I'm Dr. Sam Dube. I'm a sports medicine professional and educator, passionate about human potential and performance. Let me ask you a few questions. Do you experience pain in your feet, legs, hips, or back? Do you want to improve your performance and reduce the risk of injury? Have you tried cushioning insoles or supportive orthotics with disappointing results? Well, you're not alone. Studies have shown that fewer than 10% of people who've used cushioning or supportive products actually experience long-term relief. In fact, did you know that almost 70% of people who wear shoes experience problems and pain? On the other hand, less than 3% of habitually barefoot populations experience the same types of problems, and even those aren't debilitating. To understand why, we need to understand how a healthy body functions at the neuromuscular level. Neuromuscular activity is the way our bodies respond to sensory input as we move about every day. A critical component of our neuromuscular function is the protective reflexes that are part of our innate body intelligence. These hardwired systems are always on alert to anything that might harm us. Our protective reflexes work to protect our body in many ways. A cough, a sneeze, a blink of the eye are just simple examples, as are putting our hands out to catch ourselves if we fall, ducking when an object that's thrown at us, or pulling a hand away from a hot surface. Protective reflexes are unconscious actions that can also be consciously trained, such as when we learn to drive a car, depressing the brake pedal when required. This becomes reflexive. Once depressing the brake pedal becomes reflexive, we will unconsciously attempt to press an imaginary brake pedal when we're the passenger seat and the traffic suddenly stops dead ahead. Our protective reflexes can only work efficiently when the brain receives what we call right stimulus, which occurs when the environmental sensory input to the brain is not impeded and when there's nothing blocking the responding movement directed by the brain. We call this right movement. Now, how we use our bodies every day determines our neuromuscular functional capabilities. Our everyday activities promote either healthy or unhealthy function, which, over time, becomes the trained or conditioned norm. The conditioned norm remains functionally locked in until we train our body to function differently. Sports training and injury rehab use this principle by training with proper technique to enhance the body's functional capabilities and reduce the risk of injury. Proper technique training requires right stimulus and right movement. When we train with poor technique, we create muscle imbalances and our bodies become prone to injury. During the poor technique activities, right movement and/or right stimulus are not present. Remember the difference between habitually barefoot populations and populations that wear shoes? Simply put, habitually barefoot populations display healthy neuromuscular function. Shoe-wearing populations do not. That's because conventional footwear dampens right stimulus and impedes right movement, thereby creating a poor technique environment for our feet. Habitually barefoot populations display optimal healthy neuromuscular function because their brains receive the right stimulus and right movement unencumbered. The soles of our feet serve as a critical sensory pathway to our brains. Think about it. When we walk or run barefoot on natural terrain, the nerve endings in the soles of our feet sense every variation in the ground. During each step, there is a different sensory experience. This varied stimulus keeps the brain on high alert, anticipating the unexpected. This varied right stimulus results in optimal neuromuscular function, As one foot is contacting the ground, the sensory input it receives triggers critical protective reflex activity throughout the opposing foot and the leg while they're off the ground, anticipating the unexpected next step's ground contact. For example, during our left foot's ground contact, our brain uses the sensory input to activate a protective reflex response in the muscles that help align our right foot, leg, hip, and lower back before the right foot contacts the ground. This optimal alignment requires the arch and toes of our right foot to raise, an action that is key to the formation of a strong, stable arch system. This right movement is important because our foot's arch system plays a critical role in managing the forces created by the weight of our body while maintaining proper alignment throughout the legs and back. This protective reflex activated optimal alignment ensures that our right leg can efficiently manage any forces or stresses that may be encountered while our right foot is in contact with the ground. Most of today's footwear does just the opposite. By dampening right stimulus and impairing right movement, they promote unhealthy neuromuscular function. The result? Our bodies become poorly aligned and unable to efficiently manage the forces or stresses that may be encountered while our feet are in contact with the ground. These biomechanical inefficiencies are the underlying cause of most foot-related problems and pain. And while insoles and orthotics may provide some temporary relief, they further dampen right stimulus and facilitate poor technique function throughout our feet, legs, hips, and back. Over time, our body's neuromuscular system maladapts and we become dependent on these products, making it more difficult for our bodies to stay healthy and injury-free. That's why long-term support, bracing, and cushioning are not recommended treatments in any other area of musculoskeletal medicine. Most modern neuromuscular rehab therapies, elite athletes, and sports medicine professionals incorporate proper technique exercise in their programs. But when it comes to foot care and footwear design, right stimulus and right movement are actually revolutionary concepts. Until BioPods. BioPods insole and footwear products are based on today's commonly accepted proper technique principles. Innovative BioPods products provide the right stimulus, facilitate the right movement, optimizing the neuromuscular function of our bodies. Here's how BioPods work. BioPods products provide a safe, subtly varying stimulus to the soles of our feet, a stimulus that our brain needs to engage and optimize our protective reflexes. The result is healthy neuromuscular function throughout feet, legs, hips, and back that helps our bodies manage day-to-day forces and stresses. Over time, with constant use, BioPods work like a proper technique exercise program to train our body's reflexes to return to and maintain healthy, robust function. As our performance improves, our risk of injury is reduced. This proper technique exercise therapeutically addresses the neuromuscular cause of foot-related issues, rehabilitates and improves neuromuscular functional performance throughout our feet, legs, hips, and lower back when we use BioPod stim soles in conventional footwear. The benefits we enjoy depend on how our ability to raise our toes and arches inside the shoe. The less restrictive the footwear, the better results we'll realize. As a sports medicine professional myself, I'm confident that BioPods can provide superior comfort and therapeutic benefits for people in all walks of life. People like you.